I'm a veterinarian at the Wisconsin Equine Clinic in Oconomowoc, Wisconsin, and today we're going to talk briefly about how to bandage the lower leg of a horse. Typically, the most common reasons that we're doing that is either post-operatively from an incision, if your horse has had a wound that we have either sutured or that we're having heal by second intention, or if your horse's leg is swollen and you need to apply some type of support. So the biggest thing to remember when you're bandaging is always have enough padding below whatever is going to be your constrictive layer on top. The most common things that we use are non-stick adhesive talpas, something like the middle of a band-aid that will not stick to a wound or to sutures. And in order to hold this product on, we use a cling product, which is very soft and doesn't have a lot of give to it. Typically then, we'll just use some type of support wrap on top of this product to hold things in place. And as a veterinarian applying the bandage, we'll use a sheet cotton, which typically has a fairly thick width and has a lot of cushion once we apply it. In order to hold the cotton on, we'll use a gauze, and then over the top of the gauze, we typically just use vet wrap to hold the whole thing in place. From an owner standpoint, you can very easily do the same thing and use your reusable standing wraps or your cotton and your polo wrap over the top of that. The biggest thing to remember when you're bandaging, however, is that you always want to make sure you have a thick quilted layer underneath whatever is going to be pulled tightly on the horse's leg. It's very common that we'll get the question, does it matter what direction you wrap the horse's leg? And the answer to that is no. The first layer which we are applying against the wound is a talpa pad. This is a non-stick adhesive pad, which is very similar to the layer on the inside of a band-aid. The layer on top is cling, and this is similar to gauze. The main concern that we have here is that it is applied lightly and there is no constriction of the tendons or tissue on top of the leg. The next layer is really to keep this lower bandage in place. This is a leg cotton, which is a disposable cotton your veterinarian will use. Alternatively, as an owner, you can use a standing wrap with a thick leg cotton and a polo. The primary concern that we have here is to allow enough padding that this brown gauze will not be constrictive to the limb. In most cases, what we are doing is protecting the bandage below and also trying to keep it in place. And so we like to apply enough pressure with this brown gauze to maintain placement of the bandage and also to keep the wound underneath clean. But again, the main concern is that we have something below the brown gauze that is thick enough that as we're pulling to keep this tight, we are not constricting the tendons, the front of the leg, or any of the tissues underneath. The main concern would be quilt size and thickness of the leg cotton. If you have any further questions, please feel free to call our clinic or ask your veterinarian. Again, my name is Nadia, and I am a veterinarian at the Wisconsin Equine Clinic.